We are going to produce and sell affordable first aid kits to the people of Brazil. Some kits are small and basic with just a few necessities, such as bandages, cotton pads, antiseptic wipes, and antibiotic ointment. We also offer more comprehensive kits that will include sample medications, suture kits, and syringes. Brazil is the second largest market in the world for first aid kits, and it is a large country with many areas where it can be difficult to reach a doctor quickly. While a first aid kit cannot replace a doctor or hospital, it is a necessity to have for caring for simple wounds and illnesses or in an emergency when immediate medical attention is unavailable. While our first aid kit would not be unique in the market, we would strive to make it affordable for the majority of consumers. By including government-allowed medications, sutures, and syringes, as well as instructions on how to care for stings, bites, and allergic reactions, we would have a competitive advantage over other first aid kit suppliers. Our biggest competitor is Johnson & Johnson. Its long presence in the country, worldwide name, and subsidiaries like Band-Aid have created loyalty with consumers. It will be difficult to disrupt such loyalty for a product that has been used for many decades. However, the target markets of big companies like Johnson & Johnson are highly populated areas. The quality of their products have also changed, like the Band-Aid strip. The cheap one would not stick well, and the expensive one would stick, but will leave a sticky residue on your skin, which is difficult to remove. We can provide better quality, affordable, and eco-friendly first aid kits that will cater to the underserved market in Brazil. Our first aid kits can be customized and personalized depending on the needs of the individuals or communities in which we are selling. We support Brazil's view on sustainable development by providing eco-friendly products. Our target markets are the outskirts of Brazil's big cities, who have little or no access to urgent care or medical supplies. Another market is the tourist, who comes unprepared while traveling throughout Brazil. First aid kits will contain water purification tablets, anti-diarrheal drugs, and other medications based on consumers' demands. We have chosen to brand our product as Socorro, which interpreted into English means first aid. Our products will use themes and colors that are already familiar to the Brazilian people, such as the blue and green from the nation's flag, and symbols that traditionally represent those found on first responders, such as ambulances or paramedics. Socorro products are affordable, durable, waterproof, and designed to fulfill a variety of consumer needs. We offer basic first aid items such as bandages and ointments, or more important items such as pain relief or nutritional supplements. Our ultimate goal is to provide quality products that will reduce or postpone medical symptoms until professional medical help is available and assist individuals in many medical situations. The content will vary depending on the size of the kit and the demand of our consumers. Our sales strategy is to place our first aid kits in as many of Brazil's pharmacies and supermarkets as possible, as well as provide an online store. In the supermarkets and pharmacies, our kits will be a standardized product with a limited number of sizes and components. However, having an online store will allow us to make customized kits for consumers who need more than what our standardized kits can offer. Currently, there are over 37,000 supermarkets in Brazil, many of which are independently owned. Brazil's large geographic size, fragmented market, and preference to negotiate business with people they know make it difficult and expensive to employ and train a sales force large enough to reach all of those retailers. While there may be some disadvantages to not having our own sales force, we believe that it is better to use an agent and distributor to sell our products, as they already have the existing knowledge, connections, and distribution channels in place. Brazil has the largest e-commerce market in South America and the fourth largest in the world. Therefore, our media plan is to focus our efforts on social media marketing and purchase advertisement space on the internet, as this is a rapidly growing market within Brazil. We have created a short advertisement video which is entertaining and briefly explains the benefits of our product. We will also utilize AdWords in various search engines, such as Google, to increase visibility to the online consumer, as the search for first aid kits has increased from 10,000 to 100,000 in just 1 year, demonstrating a higher demand for such products within our target market. We feel that online advertising will allow us to achieve a greater return on investment in purchasing internet ads versus television commercials, which are more costly to produce and in purchasing airtime. Our pricing strategy reinforces our brand positioning as a quality first aid kit with various options for different income levels and medical needs. The option to purchase the base kit for only 10 Brazilian reals makes the product affordable to those in the lower income bracket who are often located in more rural areas. The higher end kit for 30 Brazilian reals is available for those in the higher income areas. We considered various options for the method of entry into Brazil. As we evaluated the pros and cons and how cultures, trade agreements, laws, and taxation have a big impact on our operations in the host country, we concluded that a joint venture is the best way to enter the Brazilian market. We plan to pursue a joint venture with one of Brazil's large local pharmacies. The advantage to this is that they know their markets, the culture, and laws pertaining to taxations and labor. After sourcing several companies as potential options for providing the components we need to produce a quality first aid kit, we chose to utilize a wholesale company, firstaidproduct.com. This company has good reviews of their products, which are offered in customizable kits, separate components, and at a reasonable cost to allow for a markup, which will include shipping and retail profit margins. They offer free shipping to United States ports, which reduces shipping costs, and with multiple distribution locations, the product can be delivered to various ports within the U.S. to accommodate demand and various shipping schedules. As a company, we feel that a combination of a geocentric and polycentric approach to staffing would most benefit our company and help as we work with the Brazilian labor market. Ideally, we will like to use as much local talent as possible, as this approach would help us be in tune with the needs of the locals and be aware of the market throughout the country. By using this method, we would be focusing on using locals to be in control of recruiting new employees, and they will know how to best meet the needs of their local markets. We have a lot of trust in the Brazilian people and will utilize them to participate in the decision-making processes. Ultimately, this method will help our company save money as we get established within the Brazilian market. One potential issue with using this method is that it would prevent local employees from branching out into different cultures and positions outside of their own. If we find that we must hire outside of Brazil for key positions, as an incentive to relocate, we will offer a salary increase of 10% during their time abroad. The cost of living is lower in Brazil than in the United States, so we will offer a minimal cost of living allowance beyond the 10% incentive. We have developed our compensation packages to be comparable to the market based on the location of the employee and in accordance with the laws of the country where they live. Any employee residing in Brazil, regardless of nationality, will be compensated in local currency, and their benefits package will be in accordance with Brazilian laws and local practices. Similarly, employees living in the United States will be compensated in US dollars, and their benefits package will be in accordance with the laws of the United States. We expect our president or CEO to reside in the United States with an annual salary of $150,000 US, and a vice president also in the United States with a salary of $100,000 US. The key positions in Brazil will be the Director of Brazil Operations with a salary of 350,000 Brazilian reals, the Manufacturing Manager with a salary of 313,000 Brazilian reals, and the Manager of Logistics being paid 160,000 Brazilian reals annually. These salaries have been determined based on compensation evaluations of similar positions in each country. This is a representation of our organization chart. Ideally, we would like to use as much local talent as possible, but we may need to have expatriates fill in for key executive and management roles if we do not find enough suitable local candidates.